This is the heart of giving. Our program is one that lets you know about what the nonprofits in the city of Long Beach are doing. People know about things that happen in the city if it's in business or government or safety or education, but they don't really know, as I've said before, about what nonprofits give to our city. I really think they're the soul of Long Beach. There are thousands and thousands of people that are involved, whether it's volunteering their time or giving money. I feel so fortunate to be here and to have a chance to bring these wonderful groups to meet you. And today is no exception. We have Elisa Nicholas, Dr. Elisa Nicholas, who is a pediatrician, but she is also the head, director, chair, let her tell you, of the Children's Clinic in Long Beach, a wonderful organization helping thousands and thousands of young people lead better lives. And welcome to you. Nice to have you with us. Very good. So how long have you been with the Children's Clinic?
I started 25 years ago at the Children's Clinic.
25 years? I can't believe it. Okay.
It went very quickly.
But you didn't start in that job that you have now.
I started as the medical director.
Okay.
I was a young physician who had done public health school and a health services research fellowship, and worked in Kenya and Uganda as a volunteer, and decided to come back and work here with people in need. And what better multicultural city than Long Beach? So
That's
it's been
wonderful.
a wonderful.
That's wonderful. And when you started, how many years had it been in operation? Do you know?
Almost 50 years. So the Children's Clinic.
You mean total now?
Now it's 75 years.
Oh, 75
We're approaching
years.
our 75th anniversary.
Wow.
We were founded in 1939 by a group of community leaders to address the needs of low-income children who didn't have access to health care. So with some of the usual players, the wonderful families that started so many things, the Bixbys, the Pillsburys, the Stantons, the Van Dykes, they were some of the original
So that giving
founders.
Started really early.
Yes.
That's
Yes.
wonderful.
Yes.
And so when you started, how big was it and what?
When
then
we
I'm going to ask you what you do. So
When I started, we had one site with 7 exam rooms in the basement of Miller Children's Hospital. We had originally been in the community in like 90813 area. When they built the Children's Clinic, the Children's Hospital, they invited us in as a tenant. We're a separate 501c3. So it was very small. Our budget, we had 18 employees. We now have 260 employees. I believe the first year I was there, we had 18,000 visits. And this year we had 105,000 visits at 8 sites.
105,000 visits of parents and children.
Yes, and we started serving adults probably about 10 to 15 years ago because there was nowhere for them to go. So the parents would say, you're helping my child, but I have a sore throat or I have diabetes, can you help me? And so we expanded our services. We met with the board and changed our mission and expanded it. The other thing we started when I came was to really work in the community because as a public health trained pediatrician, I know that it's a lot of what happens in the community affects the lives of our children. So we not only do their medical care, but we look at programs in the community. We've had immunization outreach initiatives. We helped start the Long Beach Alliance for Children with Asthma. We have a Long Beach Alliance for Food and Fitness that looks at healthy lifestyle. Those are all very collaborative programs, and we work with so many other wonderful nonprofits and city organizations. It's just a pleasure to work in Long Beach.
That's
I
wonderful.
love it.
Good. I do too. Tell me about the children, or the children we'll say. What qualifies them to go to the clinic?
So our families are all low income. 95% are under 200% of poverty level. Most of the children have Medi-Cal insurance. Some have no insurance and are not eligible for it. Our adults are more uninsured. Some of those will become insured on Medi-Cal or Covering California with the health care reform, the Accountable Affordable Care Act. But we will still have uninsured. So we have about, it varies by year between 50 and 30% uninsured. Sometimes it's a little bit less, depending on if we take over a new clinic and what that looks like.
Well, I know that you are part of the Memorial Hospital building.
Our largest clinic is on the Long Beach Memorial campus.
I see that quite often, and it's always packed.
It's always packed, and that's our largest clinic.
And the waiting room is always packed, not just the inside.
Yes, the inside, the outside. And that has 32 exam rooms. That's a very big clinic. But we have 3 clinics on school sites. At Cesar Chavez International and Hamilton Middle School, and they see children and adults from the community. International only sees children, it's our smallest. Hamilton now has 8 exam rooms. We had federal funding and county funding to expand that.
And are they manned constantly? I mean,
Yes,
you have somebody
5 days
in
a
them?
week, except International, that's an intermittent. But we're 5 days a week at those clinics. At Hamilton, we're going to be opening a family resource center. The building is now complete, and we will be having probably the opening ceremony in September, and we'll invite you. And then we're at the homeless center. It used to not be manned by the Children's Clinic, but we are now at the multi-service center, and we're the health provider there. So, and then we have a freestanding building on Pine, between 10th and 11th, 1057 Pine, and that's the Vasek Polak Children's Clinic Family Health Center, because we got funding from that foundation, and that's an 8-room clinic. And we have providers, healthcare providers that serve adults and children, and then we have room for educational activities, and now our behavioral health department has really grown. We have 3 social workers
Oh my goodness.
and 1 psychologist. And a big health education department.
Oh, that's wonderful.
And we're
I didn't know the extent of it.
Yes, and most people don't. And we're now expanding OB. Prenatal care, because the health department used to do prenatal care, so we don't, my mantra is complement, not duplicate. So we try not to do what other people are doing, but really fill the gaps in the community and address the needs in the community. So when the health department stopped doing their OB, we started expanding our OB, because we have many of the women we serve have babies, and we take care of those children. So probably by September that will be fully operating also. And so it's very exciting.
I know that.
And women's health care. We're going to expand on women's health care.
My goodness. I should have written them all down so I can remember to ask questions about all of them. But what do you find is the most prevalent? I mean, people come in with everything.
Yeah.
But what are the greatest needs?
They really run the gamut. We take care of some of the most complex children in the community and adults, because we were in the Children's Hospital for a long time and have been on the campus, so the complex children that are in the hospital many times would come to us. And our doctors are very comfortable. They work with a specialist, and we're very committed to that population, the children with special health care needs. So we probably take care of about 80% of the low-income, severely disabled children for their primary care. So that's a big part of it. We also take care of many children with asthma. We have a expertise in that. We have community health workers that actually go into the homes of the children with asthma, assess the home environment, the external environment, and do education with them and follow up for those that aren't controlled. And we have a lot of special educational materials we've developed through the years, through different grants that we've shared. Childhood obesity, you know, when I was in training, it was failure to thrive. You were worried about kids being too skinny. But the minute I came to the clinic, I noticed that we had a problem with obesity. Initially, nobody would listen to us. We were writing grants, and they said, no, poor children are skinny, they're not overweight. But, you know, some obesity is linked to food insecurity also, and not having choices.
Absolutely.
So we have been developing our approach to childhood obesity, both internally within the clinic. We train all the doctors in motivational interviewing. We have goal sheets. You know, we learn how to engage patients. You can't just say, you know, you're fat, don't eat this. You have to say, you know, do you want to have a healthy lifestyle?
Absolutely.
And if they say yes, you know, I'll say,
then
you know,
they've opened the door.
They've opened the door, and we negotiate, we motivate, we engage them, and it's not pejorative. So we have special materials. We have a community health worker that does education. And then we do a lot in the community. We're doing cooking classes with our patients and education. And then the Long Beach Alliance for Food and Fitness is a wonderful organization that we help found with many other people from St. Mary's, from the health department, exercise people, a lot of parents, and we're training them now in Champions for Change, and really working on policy changes that will make the healthy choice the easy choice. So there are 2 components of obesity: making the healthy choice the easy choice, but realizing you have to help people make that choice and help them. So, and then for the adults, it's all the complications that you see.
Absolutely.
From, we have asthma too, but heart disease, hypertension, obesity, and a lot of diabetes. And the statistics are very compelling in Long Beach. We have a lot of work to do.
Well, it sounds like you're doing a lot of work to make sure that we do it.
We're trying.
That's wonderful. And do you use volunteers?
We do have some volunteers. We have our beach walk, which will be October 26th, and that's our biggest individual fundraiser for the clinic. The yacht clubs do a regatta for us in late September, so if there are any sailors watching, we'd love to have you participate in that. But at the beach walk, we always can use volunteers. We do take volunteers in the clinic, not as many. We have a lot of AmeriCorps volunteers and Health Corps volunteers.
Okay.
We have young people.
Okay.
We have some pre-med students in the summer that come. We really would like to build that, but we need funding for a volunteer coordinator position, and we don't have that, so it's hard. We try to run lean and mean, but when you're a $20 million organization, it's not easy.
Oh, yeah.
So we need some infrastructure development probably in that area. But it has been a volunteer organization. You know,
Yes,
when I first
absolutely,
came for years,
I know.
Any new doctor that used to come into Miller
Was
Children's
volunteering.
was volunteering.
That's right.
We don't have that as much now,
Yeah.
but our board is volunteer. We have some amazing Long Beach, board members. Our treasurer was one of the founding members' grandchildren. So
My
Mike
goodness.
Van Dyke.
Oh,
So that
that's
was
great.
very nice.
Well, Dr. Elisa Nicholas, I got to tell you, I didn't even have to ask you one question. I just got you started, and you're so involved and so committed to what you do, and I'm so proud of what the Children's Clinic has done in Long Beach. And you're reaching thousands and thousands and thousands of people and families. Thank you so very much.
Thank you, and
Yeah.
thank you for Long Beach and
Yeah.
for your leadership,
Yeah.
because it's a great place to work.
bet.
I'm very blessed to be able to do this kind of work
That's
in such a
great.
great city.
Well, you can't top that, but we have another segment, so be sure you come back.